So our second speaker, without further ado, and obviously a hot topic in today's community, Dr. Andrew Walby, talking about drugs, and you shouldn't do drugs. Well, we know in this day and age that particularly the younger generation, we're always faced with, in the community, whether you're out socially, drugs, alcohol are a large part of that community. So that will never go away, but obviously Andrew is at the forefront of seeing the impacts at the end of a night. Andrew is the Director of Emergency Medicine at St Vincent's Hospital in Melbourne since 2012. He has more than 30 years' experience working in the emergency departments in Melbourne, during which time he has managed patients and families affected by alcohol and other drugs at obviously the extreme end. Whilst alcohol remains Australia's biggest drug problem, the increasing range of illicit drugs used in the community creates ever-increasing challenges for those working in the healthcare system. The prevention of drug use, in order to minimise the impact on the community, should be our focus. Andrew will provide some insights into what it is like to work on the front line, managing those affected by alcohol and other drugs, and how to avoid ending up in an emergency department yourself. So we'd love to welcome Andrew up to the stage. Thank you.
Thanks very much, and I'd like to thank everyone for inviting me to come and speak. Yes, I did quote South Park in my little bio. That may seem flippant, but it's actually a very good message. So I'm going to declare that I drink alcohol. I'm going to declare that as a medical student and as an intern, I did smoke a little bit of dope. And I did inhale, unlike Bill Clinton. I think he was lying. I had some really bad experiences smoking marijuana, particularly as an intern. I had a mate who smoked quite a bit of it, and he had a lot of friends who... he was a skydiver as well, and he had a lot of friends who used to jump out of planes after taking angel dust. My mate is ironically an anaesthetist, but he lives in Lennox Heads and surfs and occasionally gives anaesthetics in Lismore. I haven't smoked marijuana since that year, 1985, when I was an intern, and as I said, I had some bad experiences with it. I became quite paranoid at times, and we'll talk a bit further about that, but I wanted to be upfront. As I said, I do drink alcohol, not a lot, too much according to my wife. 1 beer a night seems apparently is too much, but anyway. So alcohol is by far and away our biggest problem in the community, and will remain that way, unfortunately. There are other drugs that get a lot more focused on in the media of late, but certainly alcohol is by far and away our biggest problem. When I started working in emergency departments, there weren't a lot of other drugs around. There was marijuana. LSD was very much a sort of a late 60s, 1970s drug. But now there's a whole lot of other stuff. There was a lot of heroin around at that time too. But now there's GHB, there's ecstasy, ice is the one that's getting a lot of publicity, ketamine. Anyway, a couple of weeks ago, this was Saturday night into Sunday morning in my emergency department, and this is just the drug and alcohol affected patients who came in. So, BIBA, for those of you who aren't familiar with the term, means brought in by ambulance. Brought in by friend, brought in by taxi, and we didn't have BIBP, which is brought in by police, but we do get a lot of those brought in by the police. Some of them were breathalyzed, some of them weren't, and as you can see, those blood alcohols are pretty high, not as high as some we see. It's a bit sad when you get brought into the emergency department. You have to get an ambulance to get brought into the emergency department, and there were two two patients there who came from the same venue, father's office in the city. Two of them got brought in and they were friends. One was brought in by ambulance from his sister's 30th birthday. GHB is very common. GHB is a veterinary anaesthetic. So what does it do when you take too much? It makes you stop breathing. Ketamine's also an anaesthetic agent. We use it in the hospital system, but it stops you breathing. And people die from this if they take too much. The big area of concern, and the only reason I actually went through this, ironically, was we actually had a complaint from the mother of one of those three girls at the bottom who, they were down from Brisbane for the weekend and they met a stranger. They broke all the rules of night clubbing. They let someone buy them drinks. They don't know what the drinks were. They left the drinks unattended. The only good thing they did was stick together. And they caught a taxi to the emergency department because they were feeling strange and behaving oddly, and they recognised that it would appear that their drinks were spiked. And they suspect that that person spiked their drinks. He tried to get in the taxi with them and come to the hospital, but they managed to push him away. They were observed for a period of time and then were released. And I guess the message there about that, we suspect that they had GHB. The message there is don't you take GHB, and don't be the person that gives someone GHB, because it can have quite. And one of those girls also was sexually assaulted by the man. So there are other consequences, obviously, of drug use. The one outlier there, everyone else was sort of in their early 20s, late teens, and was a 39-year-old man. No one asked me what PFO was. Piston fell over. That's a standard medical term. That was his ankle X-ray. So he's 39, fallen over drunk, and he now, who's a self-employed truck driver, is off work for weeks because he's had to have surgery and can't drive his truck. So there are many implications of alcohol use. I'm just going to play a little video.
I cared for a woman who was about my own age. So her husband had been hit by a drunk driver and deceased on the scene, and she was unaware of this. She asked for him repeatedly, and I was there with her when they told her. So that was a particularly hard day at work.
In 2014, 2,002 emergency department doctors and nurses in Australia and New Zealand responded to a survey which asked them about their experiences of alcohol-related presentations in their ED.
I was obviously pregnant. An alcohol-affected patient threatened to punch me in the stomach in front of his wife and kids.
By an intoxicated patient.
They take up a huge amount of resources, especially the trauma-related injuries.
We had a patient who didn't tell us about his chest pain for 40 minutes.
If a patient is in pain or dying, the last thing they need is yelling, abuse and swearing in the cubicle next door.
Verbal abuse is an hourly occurrence in my ED.
You only need one combative, alcohol-affected patient to completely disrupt the functioning of the department.
Staff or other patients, creating a scene or generally being
I've been verbally threatened and physically assaulted, pushed, punched, spat on and bitten.
You have no idea what it is like at 2 o'clock in the morning to be telling the parents of a 22-year-old that their child is brain dead.
Dealing with intoxicated patients takes a toll on the staff. It's very tiring and emotionally draining.
Every day. And it's not just Friday night, Saturday night. It's every day.
You know, the environment is so exhausting that people feel they don't want to come and work in that environment frequently.
Over 94% said alcohol-related presentations in the ED had a negative or very negative effect on the workload of ED staff.
Severely intoxicated, we're talking levels 6 to 8 times the legal limit, is not an uncommon finding here. These people create an enormous drain on the resources or take an enormous toll.
There's alcohol-related violence, which we all know about, people getting drunk and aggressive. There's alcohol-related accidents, there's alcohol-related suicide, there's alcohol-related sexual assault,
The degree of intoxication is more than it used to be, I think. The behaviour is different. You know, people's behaviour is out of control when they're affected by alcohol.
88% said that the care of other patients was negatively or very negatively affected.
Often patients that are intoxicated that are walking and talking will be placed into the waiting room. So what can happen though is that other patients in the waiting room can be upset by this. They're not the sort of patient that is necessarily just going to sit still and wait. They're often up and around the room. They've got friends with them and they're all intoxicated. It may only be one person that's wanted to see the doctor, but they're all creating an environment where other people are nervous or uncomfortable.
We have frequent daily incidents where patients are disturbed by people who are intoxicated. One episode stands out in my mind where we had a very intoxicated, very strong man who came in suicidal and intoxicated and was very threatening. Our staff, including our security staff, who are very big people, were wary of him and scared of him, and he threatened them. So he tried to leave the department and the security guys had him on the floor in the middle of the department and were trying to restrain him. It's very disturbing and stays with you for a long time, those sorts of events.
87% said they had felt unsafe due to the presence of an alcohol-affected patient while working in their ED.
Our night staff in particular and perhaps our registrars are taking the brunt of that increase in alcohol-related attendances and the workload and the behaviour and the potential violence that goes along with those presentations.
So the nurse always manages the situation with any of the patients, and they will call security if they feel they need it. So there can be different levels of that, where it's just a visual support or whether we actually need them, and that is a daily occurrence.
People are very, very intoxicated, they become very aggressive, and we have a duty of care to look after them. And a lot of the time they're here because they're unwell, they can't look after themselves, and then they become violent and exposes the staff to violence.
To be scratched by someone, to have wounds, to draw blood, I mean, they're very disturbing events to have occur in the workplace.
As soon as you know somebody's intoxicated, you start thinking along the lines of, where is it safe for this person to be? Where is it safe for them in terms of our staff?
98% had experienced alcohol-related verbal aggression from patients in the last 12 months.
A significant proportion of the patients that we see who are intoxicated with alcohol are verbally abusive and aggressive, and going alongside of that we experience physical aggression as well and behavioural disturbance. Sometimes people will need to be restrained both physically and chemically to contain their behaviour, and that's certainly not an uncommon event in our emergency department here.
The thing is that they're not always rational and don't understand that you're just trying to do the best for them. So often this escalates because they're being asked to stay when they don't want to.
Frequent physical and verbal assaults take a great toll on the staff.
Well, this is the whole thing. There's constantly we're exposed to violence here in the emergency department. Just in the last 5 days, we had an intoxicated, aggressive person throw a chair.
It's something that we all deal with and we all see on a daily basis.
92% had experienced alcohol-related violence or physical threats from patients in the last 12 months.
So, me personally, I've been spat on. As I said, the drunk man the last month was hepatitis C positive. He was trying to bite staff. He was spitting at staff.
I remember trying to put the drip in the bar room with people scratching me and digging their nails into my arms, spitting at me, abusing me, calling me all sorts of revolting names while I'm trying to put in a drip and give them some sedation.
We have a very low tolerance for violence or aggression, so we manage that quite quickly. And we don't leave a situation where somebody is constantly putting themselves at harm.
Yeah, there is a culture. There is a culture in our society of excessive alcohol consumption. It's almost like a badge of honour that young people want to wear, drinking these excessive amounts of alcohol. And I personally think that it has to do with the industry and the way alcohol is promoted in our society.
I think it's very worthwhile talking through why they're drinking, thinking about what factors it is that's motivating them to drink.
They don't realise when they make these decisions that the people that are in the rooms, the people that are picking them up off the side of the road, the nurses and the doctors and everybody that's caring for them has, you know, an impact on seeing these lives that are changed forever.
As an emergency doctor, I've seen how ice is destroying lives.
Did you finish that report?
I've seen people who can't sleep for days. People smoke it, not realising it can be so addictive.
No, Nick, please. Son?
Ice tears families apart.
I'm going out. No, Nick! Get off!
Some ice users dig at their skin, feeling like bugs are crawling underneath. And then there are the psychotic reactions. This can happen any time you use it. Ice destroys lives. Don't let it destroy yours.
Authorised by the Australian Government, Canberra. Some of us see alcohol as just part of our lives. So maybe it's time we all take a second to stop, think, and even talk about how much we drink, how often we're doing it, and if it impacts our lives. We could even ask if our drinking's touching the people around us. What's your relationship with alcohol? Authorised by the Queensland Government, Brisbane.